Thank you guys. I know it's been like what 3 or 4 of these in a row, and I don't know if you're getting burned out or not by it, but we have this is an interesting ALKtALK because it's sponsored by Pfizer, and we're bringing in Triage Cancer to come and speak to us. I've had so many people talk about cancer finances, and it's such a range of topics, and it's one of those things where we have a difficult time jumping in and talking to others about, because we're all different and we all come from different areas, different backgrounds, different ages, and etc. First of all, I was diagnosed in 2013. My name is Mark Rosenzweig. I'm the patient, just like you guys. And I've also had to navigate the waters of cancer finances, and it's not fun, but anyways, so today, before I introduce our speaker, I'm going to introduce some of these polling questions like I always do. So I get some new ones too, but I'm going to go ahead and this gives Monica an opportunity of who she's speaking to. So, to your disease. All right, I'm going to end the poll, share the results, and basically 1 and under is 17%, 1 to 2 years is 41%, 3 and 4 years is 28%, and 5 to 6 is 7%. So I'm going to stop sharing that poll and go back to a different poll. And what was your age of your diagnosis? How old were you? You got diagnosed. Okay, I'm on the poll, share the results. So, oh, this is interesting. 30 to 39 is 8%. 40 to 49 is 25%. 50 to 59 is 53%. 60 to 69 is 8%, and 70 to 79 is 6%. And the reason I'm saying this stuff out loud is because the recording doesn't pick it up. So, and this is a new poll. So this is kind of a complicated poll here. What answer describes your current situation? Are you working? Not working? I'll let you guys answer. I feel like I should be playing the Jeopardy song in the background. All right, I'm in the poll. Share the results. 32% of us are working. 34% of us are not working. Currently, I'm not on disability, which is interesting. 29% of us are on SSDI disability. 5% of us are on disability, private disability. We had nobody on the talk with that you applied to SSDI, you were denied, or that you applied and you're waiting for an answer. And I have one last question. And it is, do you guys have, does anyone here have copay assistance? Our drugs are very expensive, Monica. So that's why I'm asking the question. I think my drug might be like 15 grand or more, which Summer pays for me. So, all right, I'm gonna finish, share the results. 68% of us do get copay insurance, copay assistance, and 33% of us don't. So that is it. I'm going to introduce our guest. Our guest comes from Triage Cancer, and Monica Bryant is a cancer rights attorney. She's a speaker, author, and she dedicates her life to healthcare related issues. And she also wrote a book on cancer rights. And she told me to basically not say anymore. I like a one-page introduction. So Monica, the stage is yours. You have to unmute. There you go.
Yes, I know my Zoom was delayed, so I apologize. Thank you so much for that introduction. and for the opportunity to be here today. As was mentioned, I am a cancer rights attorney and co-founder of an organization called Triage Cancer. At Triage Cancer, we provide education on the legal and practical issues that come up after a serious medical diagnosis like cancer. And we provide that education in a number of different ways. So we host free educational events. We do day-long conferences and monthly webinars. We have a number of resources on our website that are all available for free. So we have things called quick guides, which are like 1 to 2 page, quick snapshots of a topic. We have a website called Cancer Finances, which does a really deep dive into the legal and practical topics. We have animated videos. So what we're really trying to do is meet people where they are with this information. Many times when I tell people I'm a cancer rights attorney, I sort of get the response of, well, what's that? Or what's legal about cancer? And the answer is actually almost everything. From what drugs you have access to what insurance has to cover, to what your health insurance options are, to, of course, what we're here to talk about tonight, which is employment. And if you can't keep working, how do you replace that income? As you saw on those polls today, there are people from varied backgrounds and are coming tonight at different stages in these decisions. So not everything I talk about is going to be relevant to you or is going to necessarily resonate, but I certainly hope something does throughout the next 40 to 45 minutes. But also know that this is not your last opportunity to get information from us at Triage Cancer. We would like to continue to be a resource for you even after this evening. We'll save a little bit of time at the end for questions. So if something pops into your head, feel free to throw it in the chat box, and I'll do my best to address them at that point. So when we talk about where does somebody look to see what they have access to in the employment context, there's a couple of different places we're going to go. So there are fair employment laws at both the federal and state levels that provide protection against discrimination for the individual who's been diagnosed, the patient, and for caregivers. They also provide a tool called a reasonable accommodation, which can be very helpful, particularly for those of you who are still working. Then there are leave laws that provide job protected time off, both at the federal and state level. But if you are an employee who is working under an employment contract or is a member of a union, then in addition to those federal laws, your employment contract or your collective bargaining agreement could provide you different or additional rights and benefits. But a lot of people forget that the law is just the bare minimum of what employers are required to provide. And many employers are, in fact, more generous than that bare minimum. So the first place someone should go look to see what they have access to is actually their employer's policies or benefits. And some of the things you might find are your health insurance options. Most people have already figured that piece out, but maybe you have access to a short or long-term disability policy through your work. I cannot tell you the number of people who I've said, well, do you have a private disability insurance policy? And they say, no. And I say, well, just go back and ask at work. And it turns out they did. It's just that the employer paid all of the premiums, or it was just something taken out of their paycheck for, a couple dollars a month and they didn't know it. Also, in most states, if you have access to paid sick time or paid vacation time, that is because the employer has decided to provide that, not necessarily because it is required by law. So taking a look at those employer policies or handbooks are really, really useful. Now, I will say over the last several years, we've seen sort of a shift away from the traditional hard copy binder we used to get that, had all of this information. Many employers are using portals or online sort of ways to disseminate this information, but smaller employers may not even have that. And so sort of asking whomever at your job you turn your timesheet into about what you might have access to at work could be a good first start. Now, one of the most valuable laws that we have in this area is the Americans with Disabilities Act, or the ADA. Now, most people are familiar with the ADA because of things like ramps into buildings or parking spots in front of grocery stores. But the ADA also did some really important things in the employment context as well. And to figure out what that is, we're going to look to Title I of the ADA. Title I is enforced by the Equal Employment Opportunity Commission, or the EEOC. And I tell you that because if you are having an issue at work, it is the EEOC that you are going to go actually get information from and potentially file a complaint. So it is important to know which agency is responsible for enforcing the law. Now, like with most of the things I'm going to talk about, there are some eligibility pieces that you have to meet in order to get to use the ADA. The first is that you have to work for a private employer with 15 or more employees, or a state or local government of any size. If you work for the federal government, you have similar rights that I'm about to talk about, but they are in fact under a different law. In addition to working for a large enough employer, you have to be a qualified individual, which basically means you're qualified for the job in question. If you are applying to be a commercial truck driver, you have a commercial driver's license. If you're applying to be an accountant, you're licensed in your state, right? You're qualified for the job. And then finally, you have a disability under the ADA's definition. Now, when we talk about cancer, I will say that more often than not, the disability stems from the side effects of treatment, not always the cancer itself. So when I talk about these things, don't just think about the cancer, but also think about, well, what are you experiencing as a result of the treatment? And to figure out if somebody has a disability, the legal definition is a physical or mental impairment that substantially limits one or more major life activities. It's a total mouthful. What we're talking about here is someone who has a physical or mental condition, and that condition is impacting something called a major life activity, which is something that's major. It's what most of us can do with little or no difficulty: walking, talking, eating, breathing, operation of major bodily functions. And that condition is limiting one of these major life activities substantially. It could be that you have one side effect that is impacting one major life activity substantially, or it could be, well, when we look at all the different things, like I have insomnia, I'm nauseous all the time, I'm exhausted during the day but can't sleep at night, I'm having trouble walking, whatever it is, when we add all those things together, that's what gives rise to the substantial nature under the ADA. So assuming that you've met all of those requirements, so you work for a large enough employer, you're qualified, and you have a disability, there's a couple different ways you can use the ADA. The first is that you currently have the disability. So maybe you are in the midst of active treatment and you are dealing with, severe nausea all day long. The second is based on having a history of having a disability. And so this maybe is a situation where someone is out of active treatment, but they are still experiencing late or long-term side effects. And then relevant for today, someone could get protections under the ADA based on their association with a person with a disability. And this is where caregivers can get some protection under the ADA. Now, one of the most interesting things about the ADA is that it applies to all phases of the employment process. So even before you are an actual employee in the job application and search process, you are protected under the ADA. All the way through hiring, promotion, demotions, firings, the whole employment arc. So what does the ADA actually give you? Well, in all of these situations, you're protected from discrimination, which means that an employer can't make employment-related decisions based on your medical information. And sometimes it's malicious, right, where they're just mean and bad actors. But more often, honestly, it comes from a good place. And we see it a lot where someone will say, well, listen, like Jane's just been diagnosed. She's got enough on her plate. We're not going to give her that project. Instead, we're going to give it to Bob. Well, it comes from a good place of not wanting to overwhelm James, but they just made an employment-related decision based on medical information, and that is not permitted. For people who currently have a disability or who have a history of having a disability, in addition to being protected from discrimination, you're entitled to this thing called a reasonable accommodation. Now, a reasonable accommodation is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Total mouthful. The easiest way to talk about reasonable accommodations is through some examples. And we can put these examples into three main categories. The first is about physical workspace. So maybe it's about moving offices. If you're dealing with fatigue and your office is like on the other end of the complex from where you park, can you move to a closer office? Maybe it's about certain equipment, or maybe it's even about working from a different location. So sometimes if someone works for an employer that has multiple work sites, like I don't know, a bank branch, and right now your commute's 45 minutes each way because you're at a further bank branch than where you live. A reasonable accommodation could potentially be moving to a branch closer to your home so your commute is cut down. It could also be about telecommuting. Now, I will tell you, this was a much bigger conversation pre-pandemic because there were a lot of employers who were adamant that their jobs could never be done remotely. There's just no way. And then, enter global pandemic, and turns out a whole bunch of things can actually be done remotely. So this is becoming slightly easier for people where it's appropriate. But telecommuting doesn't always just mean working from home. It could also mean working from a different location. And so there are lots of people who get accommodations to work from an infusion suite, for example. But that first category, really, the takeaway is it's about space. Are there changes in your workspace that could help you work better? The second category is about schedule. So is it going to part-time? Is it changing schedule? Is it a flexible schedule? Maybe instead of 5 8-hour days, you're going to work 4 10-hour days. Maybe you need different breaks or more breaks. Maybe you need more time to finish projects. So this is really about the time in which you're going to do your job. And then the last category is everything else. Can technology be helpful? If you are dealing with neuropathy in your hands and you have to type all day, could speak to type software be helpful? It could be about a change in policy. So a lot of times employees sort of get in trouble at work because they're not compliant with a policy, whether that's a dress code or a policy to check in at a certain time and they can't do that. So having a change in that policy for just the person who has the disability is a reasonable accommodation. It could also be about shifting job responsibilities or potentially even changing jobs entirely. Now, when you're thinking about potentially changing jobs, keep in mind that there does have to be a vacant position available and you have to be qualified for that position. An employer doesn't have to create a new position for you. Now, there's a couple of things that I want to talk about with respect to accommodations. The first is that a lot of times people sort of respond when I bring up accommodations as almost as if they feel like they're asking for a favor. When in reality, employers that are bound by the ADA, so they have 15 or more employees or they're a state or local government, are required to provide eligible employees with accommodations. It's not a favor, it's your right. Unless the employer can show that doing so would be an undue hardship or a direct threat. And that is a very high bar for the employer to have to meet. That being said, it doesn't mean you just get any accommodation. It does have to be reasonable and effective, meaning that whatever the accommodation is in fact addressing the issue that you're having. And what's is really very the situation, to the employee's job, to the employer, the role, all of those things. So what might be reasonable for one person in your group may not be reasonable for another. Now, caregivers are not legally entitled to accommodations, but I generally think that this falls into the it can't hurt to ask. As long as the caregiver understands that they're not legally entitled to it, asking for something like an accommodation could still be mutually beneficial. And the reason I say that is that we have data showing us that providing accommodations is actually very low cost from the employer's perspective, but actually has a very high impact. So about 56% of all accommodations cost the employer nothing. And then 39% have a one-time cost of about $500. Maybe it's that software, for example. So it doesn't cost the employer very much at all, but the impact is significant. And so this is just data showing you all the reasons that employers said they wanted to provide accommodations. And so the reason I bring this up is because I want to sort of shift people's narrative and thinking about this, that asking for accommodations is not a favor or a burden on the employer. It is actually mutually beneficial. It helps you, the employee, stay at work if that is what you want and are able to do. And it helps the employer keep a valued employee and sometimes even increase productivity. So just sort of change your mindset around all of that. Now, this discussion around reasonable accommodations brings up some practical questions. Generally speaking, we suggest that you ask for the reasonable accommodation as soon as you realize you need it. Because if you wait to ask for the accommodation and your job performance starts to suffer, the employer can make employment-related decisions like firing based on that job performance. So asking for the accommodation puts the employer on notice that you are in fact entitled. When you actually go and ask, though, you don't have to invoke the ADA or even use the words reasonable accommodation. In theory, the employer should know what it is you are asking for. However, we often see that employees are in the role of educators for their employers, and so you may, in fact, have to use the words reasonable accommodation to be very clear what it is you're asking for. The person that you're going to go to ask is also going to depend. I generally think the first step that everyone should take is checking that employer policy to see if they've laid out a process for how you can go about asking for the reasonable accommodation. If they haven't laid out a process, then you have to make some choices. So maybe it's that your direct supervisor is your biggest cheerleader, and that's the person you want to start with. Maybe it's the supervisor that's causing the challenges because they're, a stickler for policy. And so maybe you want to go above that person to HR if that exists. So it's really going to just depend on your situation and what makes the most sense if a procedure has not been laid out for you. Generally, when you ask for a reasonable accommodation, that information should be kept confidential. I say generally because there are a couple of exceptions. Sometimes information has to go up the chain of command, so to speak. Let's say, for example, you start with your supervisor and, you guys come up with an accommodation, but then your supervisor says, you know what, though, I'm really not allowed, or I don't have the authority to say that this is what we're going to do. We need to actually go to HR. So it can go up the chain of command. Now, some information can also go down the chain of command. Let's say you've gone to HR, you've agreed upon a reasonable accommodation of every Friday off. It stands to reason that your supervisor needs to be made aware that you're now getting every Friday off. Otherwise, they're going to wonder why you didn't show up to work. But all that should be shared is that you have a reasonable accommodation and it is X. There should be no medical information shared whatsoever. Now, I mentioned that the ADA is one of the most important laws in this space, and reasonable accommodations are one of the most useful tools for people who are trying to stay at work, return to work, or potentially even take time off. And the reason I say that is they're very, very flexible. You can get more than one reasonable accommodation. So it might be that you need multiple reasonable accommodations to deal with one issue that you're having. Or maybe you were having a bunch of different issues and you need a bunch of different accommodations. They also can change over time. So you might right now feel like, well, I need every Friday off. And then in 6 months, you might think, you know what, no, I need to go down to a part-time schedule. And then in 6 months from then, you're like, and I need to be able to work from an infusion suite, so to speak. So as your needs change, so can the accommodations. In addition to the federal law, we have those state fair employment laws. most of them are very similar to the ADA, but they can in fact be more protective than the ADA. And there's a couple of different ways they can be more protective, but I think most significantly is that there are state fair employment laws that cover employers with fewer than 15 employees. So if you work for a smaller company that doesn't have 15 employees, then what I would say to you is, let's look to see if your state has a state fair employment law. So if you're in California, then your employer only needs 5 employees to be covered under the state fair employment law. If you're in Illinois, then you only need 1 employee. If you don't see your state listed here, it's because your state matches the federal law and also requires 15 employees. We have a chart of state laws that has this information by state, and you can actually click on it and learn more about the state fair employment law. Now, there may be a time when you need to take time off from work. Maybe it's a surgery that's coming up. Maybe it's time that you're not feeling well. There are leave laws that can protect your job during that time. And one of the most well-known leave laws is our Federal Family and Medical Leave Act, or FMLA. The FMLA is a law that provides employees who have their own serious medical condition employees with their own serious medical condition to take time off from work, and employees who are caring for a seriously ill child, parent, or spouse. We bring this up because most people are really surprised that this is the definition of family under the FMLA. So the law does not allow someone to take job protected leave for a grandparent or an aunt or a sibling or an in-law. It is only a spouse, parent, or child. And so that can be very limiting. In order to use the FMLA, again, there's some requirements. You have to work for a private employer with 50 or more employees, so much bigger threshold employee-wise, or the state, local, or federal government. In addition to working for a large enough employer, you have to have worked for that employer long enough. And there's 2 different time requirements. The first is that you worked for that employer for a total of 12 months. And in the last 12 months, you worked at least 1,250 hours, which comes out to be a little bit more than part-time, or a little bit less than part-time, excuse me. So what does the FMLA give you? What is the big deal? The FMLA provides up to 12 weeks of job protected, excuse me, leave per year. Now, the good news is it's job protected, which means that you cannot be fired or demoted while you're out on FMLA leave. The bad news is FMLA leave is unpaid. We're going to talk about how you can potentially address that unpaid nature in just a minute. But there's a huge misconception where people will say, oh, I'm out on disability. Well, that's actually not a thing. So it could be that you're receiving disability insurance that is giving you some of your lost wages, but disability insurance, along with sick leave or vacation time, does not protect your job. You can be let go from your job while you're out on sick leave. It's the FMLA that provides that job protection, and we always call it the protective bubble of the FMLA. We have lots of resources on the FMLA if somebody is interested in learning a little bit more about this. But it is a very, very useful tool to be able to use at the same time as some of those other benefits you might have access to, like short-term disability or sick leave. Now, just like with the fair employment laws, there are state, county, and city level leave laws. These are all over the place, so there's no easy way to talk about them. But what you can see is there's some leave laws that provide protection for smaller employers. Some have expanded their definition of family. Some have said, oh, there's actually different things you can use your FMLA leave for. So I will say, if you are interested in learning more about what's available in your state, take a look at the triagecancer.org/state laws page. And under the employment tab, there's a whole section for leave laws, and you can learn more about what's available in your state. Let's switch gears though and talk about what happens if you do need time off or if you can't work at all. What options do you have to replace that lost income from work? And that's where disability insurance comes into play. If we are talking about private disability insurance policies, again, it's really tricky to talk about them generally because they're all going to be very specific to the policy itself. But generally, policies are going to replace somewhere between 45 and 90% of your income that you got when you were working. Private disability insurance can be purchased in a couple of ways. So it could be something where you go out and purchase the insurance from an insurance company yourself. It could also be, as I mentioned earlier, something that you get as an employee benefit. When we're talking about private disability insurance, there could be short-term plans or could be long-term plans. Again, the details about what is short-term, what is long-term is going to be really specific to that policy. Generally, short-term is going to be, up to 6 months, maybe all the way up to 12 months. If we're talking about long-term, it means it's a disability that's lasted for a year or longer at this point. Now, there are a handful of states that have state disability insurance. And when I say a handful, I literally mean a handful. So there are 5 states and Puerto Rico that have these programs. If you are in one of these states and would like to learn more about the state program, we have a quick guide on state disability insurance as well as some more information on cancer finances about these state programs. Because again, they do vary from state to state. And then finally, there are 2 long-term disability insurance options run through the Social Security Administration. Those programs are called Social Security Disability Insurance, or SSDI. The other one is Supplemental Security Income, or SSI. There's a lot of S's and a lot of other letters in here. It gets very, very confusing for people to understand what they could potentially access or sometimes even what they're on. There's a lot of differences between these 2 programs, but one similarity is the definition of disability. So the Social Security Administration defines disability in a way that it says you cannot do your job and you cannot adjust to a new job, and your disability has or is expected to last for at least 1 year or result in death. So it is a very high bar to meet the SSA's definition of disability. It's also a little bit tricky, especially in groups like this where you all have similar diagnoses and some people may have access to disability insurance and had no problem, and then other people are getting denied, and you might be thinking this makes no sense. Part of the reason for that is that even though these 2 programs are federal disability insurance programs, the entity that makes the decision as to whether or not you are eligible for this program is actually a state agency. And so the state agency is called Disability Determination Services, or DDS, and those are different from state to state. So if you are in 2 different states and you're like, I don't understand why we got 2 different answers, it literally could just be the 2 different agencies. Now, a question that we get a lot, and there's a ton of confusion around this, is, well, can I apply if I'm still working? And the answer is, it depends. The Social Security Administration will do a 5-step assessment to whether or not you're eligible for these programs. And the first question is, are you working, earning more than $1,470? And that amount is also known as the Substantial Gainful Activity Amount, or SGA. Why we needed 3 words for work, I don't know, but here we are. So it could be that, yes, you are working, but if you are earning under that $1,470 a month, then the Social Security Administration does not consider that working. If you can say no to question one, you go down the list. Most of the time, especially with diagnoses like yours, it's not an issue until you get to number 5. Because people will often say, well, I can't do my job. Maybe you were an occupational therapist and you just can't do that job anymore. So you're wondering if you could be eligible for SSDI. The next question is, okay, great. You can't be an occupational therapist anymore. Can you put groceries in a bag at Walmart? The answer is yes. Then you are going to fail at number 5 and not be eligible. So it's really, really important that when you are applying for disability insurance, you are focused in on why you are unable to work. Not why you're not able to do your job, but why you are unable to work, period. There is a program, and I apologize that I did not look ahead of time, but there is a program run through the Social Security Administration called the Compassionate Allowances List. And this list started in 2008. And what it is it's a list of diagnoses or medical conditions that the Social Security Administration has decided are going to be presumptively eligible. It doesn't mean it's a guarantee, but I always think of it as it just kind of makes the hurdle you have to jump over a little lower, a little easier to get over and get into the program. And I am apologizing because I did not look to see if this diagnosis was on the list, but it's certainly something that I could do afterwards. Now, if you are on the compassionate allowances list or your diagnosis is on the compassionate allowances list, it basically just speeds up the application process. It doesn't mean you're necessarily going to get access to benefits faster. It just means the application will get processed faster. So let's talk about the differences between the two programs. So starting with supplemental security income, or SSI. This is a program for individuals who have a lower income level and a lower resource level. Resources are things like savings accounts or a retirement account or a life insurance policy with a cash value. So low income, low resource, and have a disability. So with SSI, it is pretty standard across the country. Most people are going to get $914 a month from the federal government. There are a handful of states that add some extra money, like California, for example. And generally speaking, individuals who are eligible for SSI are also eligible for Medicaid for their health insurance. That's SSI. So low income, low resource level, SSI. SSDI isn't about your income or resource level. It's about your income. It's not about your resource level at all, but rather it's about having worked and paid into the system during those working years. You have to have enough credits to be eligible for SSDI, but generally people who are working full-time, at least 5 of the last 10 years, are going to have vested and be eligible. The amount of money you get from SSDI is going to be based on how much you pay in. So Mark Zuckerberg, the founder of Facebook, is going to get more from SSDI than I will. But there is also a cap. So the max amount someone can get from SSDI is $3,627 per month. Now, SSDI has a built-in waiting period. So once the Social Security Administration decides, it's called your disability onset date, which is the date you could no longer work, you have to wait 5 months from that date in order to get benefits. There is little else that I talk about that makes less sense, because here we are talking about individuals who have disabilities so severe they cannot work, and yet we are saying, hold on for 5 months until you can get any of your benefits. It's really challenging from an advocacy perspective, from my perspective, because it puts people in a really tough situation. There is some legislative efforts to eliminate the 5-month waiting period, so we'll see. Now, SSDI is interesting because the Social Security Administration is way backlogged. I mean, they have more applications than they know what to do with. They were backlogged before the pandemic. The pandemic just made it worse. And so it can take a long time for them to process the applications. To make up for that long time that the Social Security Administration takes, with SSDI, you can get back payments, which means they look at, okay, when did you apply? And then when did we say, yes, you're eligible? And we will pay you for all of those months in between, because it's our fault that we took so long to deal with your application. So that's called back pay. It's from the date of approval back to the date of application. With SSDI, there's also something called retroactive pay. Now, retroactive pay is capped at 12 months, and here's why. With retroactive pay, what we do is we start at your date of application and we go backwards to the date the Social Security Administration said your disability began. Because sometimes it takes people a little while to figure out, oh, this is something that's going to last for a year or longer and I cannot work. Sometimes it takes a little while. So it could be that you didn't apply for several months. And then you did apply, but the Social Security Administration says, well, your disability began way back when. They will pay you up to 12 months of retroactive pay, excluding that 5-month waiting period. In the context of cancer, there's no way to eliminate the 5-month waiting period. Once somebody has been receiving Social Security disability insurance for 24 months, they then become eligible for Medicare. Medicare is the federal health insurance program for individuals over the age of 65 or people with disabilities receiving SSDI after 24 months. So I know that timing is confusing. I'm going to go through a couple of examples, but if you aren't even 100% sure if you've vested and you're curious and like, well, how much would I get monthly if I was on SSDI? The way that you can find that out is by signing up for a My Social Security account. The Social Security Administration used to send out a piece of paper every year with your earnings and your work history credits, and you would get to kind of see like, well, if you retire today, this is how much you'd make. They are not consistent with sending out that piece of paper anymore. Really, what they're suggesting people do is look on their My Social Security account. And when you sign up for this account, if you see a green bar across underneath where it says eligibility and earnings, it means you have the work credits and you are eligible to receive SSDI. If you keep reading, you'll also see an estimated amount you would get monthly if you applied now, and then a link to actually start your disability application. So when you're figuring out sort of the timing of all of it, we think the best way to do it is to figure out, well, what back pay are you owed? So remember, back pay is going to be between application and approval. Then we're going to figure out if you're entitled to any retroactive pay. So that's application back to the date of disability onset. Then we're going to figure out your entitlement date. Your entitlement date is the date that you are eligible to start getting money. Typically, the entitlement date should be 5 months after your disability onset date, because we have the 5-month waiting period. You're now eligible or entitled to receive benefits. So that should be 5 months from your disability onset date. But not always, because sometimes you waited too long. Once you've done that, if you can figure out your entitlement date, you can always figure out your eligibility date for Medicare because it's going to be 24 months from that date. So I want to go through an example. What you see across the bottom are the months of the year, starting with March. So we have March, April, May, June, July. And Jackson just applied for disability benefits on June 1st for a disability that began February of the year prior. So the disability onset date, we're just assuming he got a letter in the mail, the Social Security Administration said, yes, your disability onset date was February 28th of 2015. They approve his application on September 1st of 2016. So his 5-month waiting period is going to start on his disability onset date and go forward 5 months. So what is his entitlement date? It's the first full month after the 5-month waiting period, which is August 1st. So is Jackson entitled to any back pay? Yes, because back pay is between application to approval. So he gets 3 months of back pay. He's also entitled to retroactive pay from application back to entitlement date. And so now that we know entitlement date, we also can move forward 24 months and know that he is eligible for Medicare on August 1st of 2017. So a couple of things with this. A lot of times, well, I'll get there in just a minute, sorry. So let me give you one more example. Isabel is applying for SSDI for a disability that began on August 31st of 2014. But she doesn't apply until June 1st of 2016 because she just didn't know that was possible for her. Her application is approved December 31st of 2016. Makes sense, takes a little while. So the first thing at this point that we can do is figure out what is her entitlement date. And the way we start with that is, well, what's the 5-month waiting period? We start at the disability onset date and we move forward 5 months. Then we figure out, well, is she entitled to retroactive pay? And she is, from application back to disability onset date. But because retroactive pay is capped at 12 months, and Isabel waited so long to apply, she actually is going to miss out on benefits for the 2 months between the 5-month waiting period and when her retroactive hits. And so I bring this up because a lot of times people will say, I'm going to wait and see if it gets better, or I'm not quite sure what I'm going to do. I don't know if I want to go back to work or not. And what we generally say is it's better to apply and not miss out on these months of eligibility than to wait too long. And you can potentially go back to work even, than wait too long and then you miss out on eligibility. And this is important when we talk about Medicare too, because remember, Medicare is based on your entitlement date. It's 24 months from your entitlement date. So here, Isabel is actually going to have to wait an additional 2 months because she waited so long to apply for her SSDI. We'd also want to just double check, is she entitled to back pay? Remember, back pay is from application approval back to application date. And here she is, she's entitled to 7 months of back pay. So, I'm sorry. My thingies got messed up. So this is what I'm saying. So she's entitled to Medicare June 1st of 2017 because her entitlement date was June 1st of 2015. And if this feels confusing and a lot and overwhelming, you are certainly not alone. I will tell you though that we have a quick guide to SSDI and Medicare and timing. And it includes these examples that you can read through on your own to try to make sense of all of it because it is incredibly confusing. So I mentioned that SSDI has a 5-month waiting period. How do you fill that gap? Sometimes people can get SSI first and then SSI carries them through the 5 months. Sometimes they have access to state disability insurance or private disability insurance. So these are some options, although we realize that they are not perfect. Now, I will tell you about 65% of all applications are denied on the first try. You have the right to appeal. On your first level of appeal, it is incredibly important to work with your healthcare team to document the medical condition you have and how it affects your ability to work. If, however, you have to go to another level of appeal, it may in fact be helpful to have a disability attorney with you. The way that it works is on contingency, so they only get paid if you win, and then they take a percentage of your back pay, generally up to 25%, capped at $7,200. Now, another question that we get a lot is, well, what about my private long-term disability and SSDI? Many private disability insurance companies will make you apply for SSDI because they want the government to pay their portion. If you're eligible for both, you can keep both, but it's going to be prorated. So you don't get to make more when you are on disability than when you were working. Also, if you end up receiving retroactive pay for months that you received long-term disability, you're going to have to pay that back because otherwise you'd be double dipping. So the way that it generally works is you start receiving your long-term disability at 90%. You apply for SSDI in July, it's approved in January, and they're going to pay you 50% of your salary. So from January to June, long-term disability pays you 90%. Starting in October, now long-term disability is only going to pay you 40%, and SSDI is going to pay you 50% to make you whole at 90%. But those months between June and October, you are now getting retroactive and back pay, but you've already gotten 90% from the long-term disability. So you don't get to keep both. So you do have to pay 50% back to the long-term disability company. Now, we have an entire page on our website dedicated to resources on disability insurance, so please feel free to take a look at those. I mentioned our free events. We have one coming up on May 20th. It's a day-long program, open to anybody, so patients, caregivers, healthcare professionals, advocates. I will tell you, though, that registration closes tomorrow for that program, so if you're interested in coming in May, please hop on our website and register. Otherwise, we're also doing the program again in October. And then I'm going to take questions for a few minutes here for you. But if your question doesn't get answered today, or you have questions in the future, we do have a legal and financial navigation program where you can fill out a form on our website and then schedule an appointment with one of our staff to talk to you. So we'll listen to your situation, and then we will give you information about the various laws that might apply and your next steps. So I will leave that up in case somebody wants to write down that link. And then Mark, I will turn it back over to you to see if there are questions.
Well, there's so much information, my head's about to explode. But one thing I want to say is that when you do get SSDI, can you speak a little bit about the limitations of your if you're working part-time?
So you can continue to work, but you have to make under that $1,400 a month, that substantial gainful activity amount. And so what some people will do is, if they're part-time, they just make sure that they're not working hours that's going to pay them over that amount.
Which I think people have to understand that, because if you make $1 more, they cancel your Social Security disability.
Well, they don't just cancel it. What it would be considered is something called part of the trial return to work period, but it's limited in how many months you can do that. So it's not like your benefits are just going to get cut off that day, but you can't do that too many months because then basically the Social Security Administration will say, well, you're earning over that substantial gainful activity amount for more than the 9 months, so you can go back to work.
And I want people to understand that if you are on disability, it doesn't pass through to your heirs if you pass away. Am I saying that correctly?
Say that one more time.
if you're on SSDI and you're not in Social Security, you if you pass away, you don't get your Social Security disability.
It's not quite as simple as that. There are some survivors benefits.
Okay,
but
explain
it
to us
is,
what that is.
well, it's a little too in the weeds to get to it in the next 4 minutes. But what I will tell you is we have a quick guide on survivors benefits, and we have several blogs on it as well, because it's about ages and the ages of the kids and the survivors. But you are correct in that it's not necessarily something that's an automatic ongoing payment that somebody's going to get. We do sometimes get the question, though, of, well, you know, my husband's application for SSDI wasn't approved in time and he's passed away. So is it worth continuing with the appeal? And in those cases, we would say yes, absolutely, because if he's entitled to any back or retroactive pay, that money goes to his estate.
Interesting. I just want to make sure that people understand that walk us through, if I'm a new patient, how do I sign up for your services and how does it work?
So you come to our website, you can sign up for our newsletter. We've sent out a monthly newsletter that talks about any new resources and upcoming events. You can sign up for individual events on our website at triagecancer.org. We have monthly webinars that are about usually 90 minutes. You know, you can read anything on our website or print it off as a PDF. And then, of course, if you have looked at all of our resources or you still have questions, like you have something that's really specific, you can certainly avail yourself of the legal and financial navigation program. So you just go to this link at triagecancer.org/gethelp. You fill out a quick intake form. We ask some demographic information, household size, income level, because those things are going to help us determine what you may or may not be eligible for. But we don't have any eligibility requirements to use our services. So it's not, you know, you don't have to have a certain income to use our services. And then once you fill out this form, you'll get an email with a link, and then you pick a calendar time to talk to us, and then we give you
your services are free of charge.
Everything that Triage Cancer provides is free.
There's a ton of questions here about copay assistance programs, which you don't deal with. Drug companies, you don't have any advice on that, correct?
Well, I have lots of thoughts about it. What I will say, though, is, and this is perhaps a talk for another session, but what we're seeing is, especially for specialty drugs, where insurance companies are denying those drugs, and they're essentially doing it, well, I won't say that. Pharmaceutical companies, most of them are saying now, we can't give you free drug unless if you have commercial insurance, because the insurance company should be covering that. So if you get a denial from your insurance company, you absolutely should appeal that denial. And we have tons of resources on how to appeal, because we know that about 40 to 60% of appeals are decided in favor of your patients. So really, really important to go through that appeals process, even though I fully recognize it's a big hassle and another thing to put on your plate. In terms of the copay assistance, it's going to depend on the type of insurance somebody has. So if somebody has Medicare already and they have Part D, then their options for copay assistance are going to be pretty limited, to be perfectly honest. At triagecancer.org, under cancer finances, we have a drug assistance, pharmaceutical assistance tab, and that has all the different pharmaceutical companies and all the different drugs and assistance programs. And you can kind of understand, is it a copay assistance, is it free drug? And then you can click straight to their application. But many of them are in fact going to have eligibility requirements, like income level, for example. So again, hard to talk about it generally.
So if you have SSDI and you are in the 24 months passed, and you don't have a other coverage of your, you just have A and B, you don't have a D, which is your drug card, basically. That's where the problem lies with most of us who are at SSDI.
Well, actually, no. So where the problem lies is that even if somebody has Part D, there's no out-of-pocket maximum. And so someone could have to pay upwards of $7,000 to even be in the catastrophic coverage. And then you're paying 5% of your drugs for the rest of the year. Well, to your point, right? If you're taking a $20,000 a month drug, 5% of that is still a lot of money. I will say there is good news in that we've had recent legislation that's changing the way that Part D is going to run. So there's, in 2 years, essentially, there is going to be a $2,000 cap on the amount that you're going to pay out of pocket in Part D, which I know is not all that helpful in this exact moment, but there is some relief coming.
There's one question here that I don't think I covered. SSDI back pay, retroactive pay, is it automatically provided by the government, or does that person need to apply after completing the 5-month waiting period?
It is automatically provided. So what happens is in your first check, essentially your first check is going to be huge because it's going to include all those months of back pay and retroactive pay. Don't expect that that's going to be the check you get every month from there on out. Because
and the STA amount, is it all the same for all of us?
There is a different amount for individuals who have blindness. That amount is actually a little bit higher. But for every other medical condition, that is the SGA. Okay.
And I know you have to go, but can you give us any advice as cancer patients of if you were, I know it's so individualized, but if you're a person who's debating of applying for disability, what would be some of the factors that you might ask a patient about that? Because it is a financial difference.
It certainly is for many, many people. I would say, is there a possibility that the Social Security Administration could say you can work? Is there another job that you can do full time? And that is going to be so individualized, but typically by the time people get to me and they're asking about disability insurance, the answer is no. For a number of things. And so then to me, what I say is, well, 2 things. One, just because somebody applies for disability insurance, and even if they get disability insurance, doesn't necessarily mean they're going to be unable to work forever. There could be something that changes and you could potentially go back to work. And in fact, there are lots of programs through the Social Security Administration that are collectively referred to as work incentives. That trial return to work period I mentioned is one of those, where they actually try to help you get back to work and maintain your benefits, including your health insurance and your payments during that time. So try it out and see if you can go back to work. For a lot of people, one of the biggest things that they hesitate around is around this idea of finality. Like, if I make this decision to apply for disability insurance, like I'm giving up on the possibility of ever being able to work again. And that's not always the case for everybody. I would also say, talk with your healthcare team. Make sure that they're on board and willing to help you document how your medical condition is impacting your ability to work, because that's going to be key for a successful application. And they may also be able to help give you tips and suggestions about what to be putting in the application about your medical condition as well.
So have you had people that go on disability, come off of disability, work for 2-3 years, and then apply again? Or is that solely uncommon?
Yep, that happens. And in fact, I believe it is 5 years. So if you go back to work, and then I'm almost positive it's 5 years, but I would have to double check. If it's the same disability that you were originally approved for, and now you can't work again, your benefits are automatically reinstated.
Great. All right. I appreciate it so much that you were able to come on and join us. And I want to thank Pfizer again for helping us make this happen. And I don't know, is there any last final words for us?
Well, I would just say thank you so much. And I certainly hope to see some of you at the conference or at our webinars. And do please feel free to reach out if you have questions. Great to be here.
Okay, stop sharing your screen for 1 second.
I'm trying,
Everyone's
sorry. Okay, there we go.
Say thank you to our guest, and thanks for seeing everyone again. I appreciate it.
Thank you.
Thank you.
Thank you.
Thanks a lot.
Thank you. Thank you
Thank
so
you.
much.
Thank you very much.
Thank you.
Thank
Have a
you.
nice day.
Thank you. It was a very good session.
Oh, thank you. All right, take care, everyone. The next ALKtALK is gonna be on June 11th. So we have a little bit of a break, but see everyone. Take care.
Thank you.
Take care,
Bye.
bye.
You too. Take care.
Bye.